Hello, everyone. My name is Hattie Massey, and I'm here to teach my Healthy Hacks with Hattie class. And a little bit about me, I started essential oils probably 10 years ago because I was on a lot of medications, had a lot of diagnosis, and I was just tired of taking medicines for side effects of medicines for the issues I was having. So I was trying to find a solution where I could do it naturally instead of taking medicine. Now, with me saying that, I did not do this on my own. I did it with my doctor. She walked me all through it. We tackled one thing at a time, and eventually I got off almost all of my medications. I still am on some, but I'm definitely not on 26 anymore. So that began my journey about finding protocols and recipes and things like that to help me, my family, my friends, and everything with these essential oils. So I'm just here to share them with you. And today we are going to talk about kidney stones and UTIs. And these are personal stories. These are protocols that I have used myself. So I am going to go ahead and share my screen. Okay. And you guys have any questions, feel free, stop me. I'll answer them through this presentation if you have any questions. It is probably going to be pretty quick. I don't like to keep you guys too long. So anyway, welcome to the class. And I need to read this to you. Oh no, it disappeared. Hold on. Do you guys still see the screen?
Yep.
Okay.
Yep, it's there.
All right. I am not a medical professional. I am an independent Young Living brand partner sharing my personal experiences and general information about Young Living essential oils. This content is not intended to diagnose, treat, cure, or prevent any diseases. Always use essential oils as directed on the label and consult a qualified healthcare professional if needed. So these are just my experiences, what me and my family do, but I just like to share them. And if it's something that may work for you that you would like to try, then you have the recipes. But as I did when I got off my medications, I do recommend before you go in too far into it that you do talk to your doctor about it. So why did I find natural solutions for my kidney stones and UTIs? Because I hated going to the emergency room. I was getting kidney stones all the time. It felt like I was going to the emergency once a month. And when you go to the emergency room, it does not matter at all what kind of medicine they give you, pain medicine wise. It doesn't matter. You are in pain. You are doing the dance, nothing touches it, and you just have to deal with it until it goes away. Well, I found some oils that I put together that I haven't been to the emergency room for kidney stones in probably, well, the last time I went was my niece's wedding because I forgot my oils when I went to her wedding and I had to go. So it's been quite a while. So the oils that I chose for my protocol and why, I broke down the oils that I use for this protocol, and then I put the recipe at the end. I will share this slideshow. You'll have the recipe and everything for that. So the first thing I use is eucalyptus. It assists in managing the pain and the inflammation from having the kidney stones. I use juniper. It aids in the diuretic properties to increase the urine to flush out the kidney stones. Another tip about juniper, if you have night terrors or nightmares, or a child has night terrors, because I know a lot of kids do, you put this in their diffuser at night and it helps with night terrors. Juniper is good for many, many things. And it's not a very common or popular oil, but it does help the kidney stones get going once they get smaller and you're able to pass them. Lavender. I always say lavender, anything is calming when it comes to lavender. It helps calms everything down. It manages the pain that is associated with passing the kidney stones. Aromases. I don't hear much about this one either, but this oil is absolutely amazing. It aids in managing the discomfort and muscle tension associated with the kidney stones. These first few oils, like the eucalyptus, the juniper, the lavender, aromases, and I think there's two more. I put all these on topically. And there's a tip about layering, because we want to layer these on, and I'll talk about that at the end of this. Peppermint. Peppermint aids in the intense pain associated with kidney stones. When I talk about layering, you want to put them on one oil at a time. Peppermint always needs to be your last oil because it kind of penetrates the other oils deeper into your body. So you want that one on the very last one, the very top layer of the oils. Now we're going to roll into what I take internally at the same time when I'm putting it on topically. So lemon, this is not like, you take a real lemon and it's very acidic. This lemon is not acidic, so it doesn't like crush up the stones. It doesn't have that same acid as natural lemon, but it does aid in the detoxification and it supports overall kidney function. Rosemary oil helps prevent stone formation and aids in relief of pain associated with passing them. And if you notice, all these things, they're very similar oils, but they all aid with comfort and passing the stones and the pain and everything, because kidney stones is a very painful, it's just like a tooth infection or giving birth. Kidney stones are horrible. And then the last one I take internally is geranium, and it aids in the stimulation of urination to help flush out toxins. So it's kind of like the juniper, where it stimulates the flow of the kidney stones to get it out. So I take it internally, and then I take it topically. So here's my recipe. I put 2 drops of each of those oils. And like I said, you want to layer it. So you want to put the eucalyptus first, then you want to put and the juniper, the lavender, the aroma seeds, and then the peppermint over an area. I usually have to do it once, maybe twice, and then my pain's gone. I'm done. And as soon as I put this on, that intense kidney stone pain is not there anymore. It's still there. It's still subtle, but it's not that intense when it first comes on. And step 2 is the water. I put 10 drops of lemon, 10 drops of rosemary, 10 drops of geranium. I add this to a large glass of water. You should use glass, or stainless steel, because it does have the lemon in it, which does eat away at the plastic. And my recommendation, this is the biggest tip of this protocol. Make sure you chug this down. It has a horrible, horrible taste. And then continue to drink water as much as you can, as much as you need. If you have to repeat this, I would not repeat this before like 4 to 6 hours. I hope it doesn't last that long, because that would just be horrible. But this, because it's such a strong 30 drops of oil, I've never had to take more than 1 bottle of this. And if you want me to be honest with you, I do put it in a water bottle, because I literally have it down me in probably 3 to 4 seconds, because I can't stand the taste, but I know the benefits. I know what it's doing. So I just roll with it. Now we're going to talk about UTIs. A lot of women do have UTIs, and it seems like every time you have one, you have to go to the doctor and you have to get an antibiotic. Now, I'm not kidding when I said in the beginning, I'm not a professional. I'm not a doctor. I'm not telling you not to go see your doctor. These are just protocols that I personally use. So these are all taken internally, and it's taken in a little gel cap. So it contains Thieves contains several different oils: clove, cinnamon, lemon, eucalyptus, and rosemary. And it helps aid in antimicrobial and antibacterial properties. And that's what a UTI is a bacteria infection. Oregano, it has an antimicrobial properties that can aid in bacterial UTI. It also has anti-inflammatory properties, which, whenever you have an infection, you also have inflammation. And then frankincense, my king of all oils. When in doubt, pull Frankie out. It has the amazing antimicrobial, anti-inflammatory properties, and it also has amazing pain relief. And all I do is I put 5 drops of Thieves, 5 drops of oregano, 2 drops of frankincense, and I add it to a veggie cap, and I take this 3 times a day. Usually I have to take this like 2 to 3 days, and my UTI is gone. So May's final drop. When layering oils, it is so good to wait 30 seconds in between each layer of oil. So that allows your skin to actually absorb the oil and push it down and do what it's supposed to do. And then once at the very end, when you put your peppermint oil in, it just pushes everything it needs to push down into the area that you're trying to address. So I told you it was going to be quick. I do thank you for joining. And is there any questions that anyone has?
Have you used that kidney stone pain concoction for anything other than kidney stones?
I haven't. That's just my protocol for kidney stones.
Okay.
And I'm telling you, aromas, I don't know if it's C's or size. I don't
Yeah.
know how to say it, but that oil is absolutely amazing when you have any muscle pain or anything like that. Massaging, like if you're a type of person that will go get a massage, and it's
Yes.
an amazing oil to take with you with a carrier oil.
Okay. I'm just going to ask if a carrier is needed. Perfect. Thank
Well,
you.
a carrier oil is not needed, but a
Mhm.
carrier oil helps when you're getting a massage, spread it further so you're
Blend
not
it
using as
farther.
much oil. Yeah. Yeah. It's not a hot oil or anything.
Okay. Thank you. This
You're
is
welcome.
amazing.
I know it was quick, but I just like to give the information, give why I use the oils and throughout the recipe and then answer any questions that you guys have. So,
And the cool thing, I don't know, I know I just, I think it was from one of the last calls you gave. I didn't even realize that Young Living had the capsules to put all those
yep,
oils in. So besides her telling you all of that, you can actually buy the capsules too, which
you
I
can.
did.
And they're super cheap. I don't know where my bottle is. I think there's like 250 capsules for like $3 or $4. I
Yes.
mean, it's dirt cheap. UTI 3 times a day for 3 days. Personally, that's what I've only had to do it like 2 to 3 days, and my UTI's gone. Thanks, Mary. Trying to catch up on these chats.
It's so good.
Okay. All
Thank
right.
you.
Well, thank you for coming. I'm going to go ahead and stop recording if I can. You guys have a good night.
Thanks so much. Appreciate it, Hattie.